So good day everyone, my name is Debuff, your student nurse from Nevasia University of Science and Technology, BSN3C. And for today's video, I'm going to demonstrate the assessment for cranial nerves. We all know that cranial nerves is very important in our life because it helps to minute the details of our life, and if damaged, it brings a permanent impact in our lifestyle. So for the assessment, check for the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, and assess mental status or ability to participate in the procedure. And for the planning, if possible, determine whether screening or complete neurological examination is indicated. This impacts the preparation of the client, equipment, and timing. For the equipment, prepare the equipment's precaution hammer, whips of cotton to assess the light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, or quinine flavors percussion, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. For the implementation, first we need to introduce yourself and verify the client's identity. Explain to the client what we're going to do, why it is necessary, and how the client can cooperate. Hi ma'am, good day. By the way, my name is Debuff, your student nurse for today. May I know your name, ma'am?
My name is Regeline Escortensio.
When is your birthday?
March 21, 2008.
Is that okay that I will check your wristband for verification?
Okay.
Okay, great. Thank you. So, by the way, ma'am, the procedure that I'm going to do to you is to assess for your cranial nerves. Is that okay with you, ma'am?
Yes.
It is very important for us to know if you have any abnormalities present. And I will touching some part of your body, and there have some movement that you should follow during the assessment. Is that okay with you, ma'am?
Yes.
Okay, great. So, ma'am, do you have any clarification or concern?
None.
Okay, is that so? Let's start the assessment. The next procedure is we need to perform hand hygiene and observe other appropriate infection control procedures. So, remove all the accessories. After hand washing, provide for the client's privacy. And next, inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as the onset and aggravating and elevating factors, disorientation to time, place, or person, speech disorder, and history of loss of consciousness, fainting, convulsions, trauma, tingling and numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with the smell, vision, taste, touch, or hearing. So, ma'am, do you have any history of what I said before?
No.
Okay. And for the cranial number 1, which is the olfactory, ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. So, Reggie, I want you to close your eyes. Close your eyes for me, please. And then, smell it and describe the odor.
Coffee.
Yeah, that's right. A coffee. So now, the patient is able to identify the odor. And for the cranial nerve number 2, which is the optic, ask the client to read the Snellen chart. So now, Reggie, we're going to test your visual acuity using the Snellen chart. What you're going to do is you're going to have a 20 feet from the chart. So, Reggie, stand up. So, Reggie, stand about there for me, okay? Okay. I want you to cover your right eye. And from here, try to read the lowest line that you can read, okay? Okay, ready? Read it for me, okay?
FELOPZD.
That's right. And to the other side, the left side, cover it and try to read the lowest line that you can read.
DEF P-O-T-E-C.
That's right. So, Reggie, I want you to read it with your both eyes. And let's start.
D-E-F-P-O-T-E-C.
That's right. Thank you. Patient can read from the line 8, so that means she has a 20/20 vision. Another one is check the visual field by confrontation. So, Reggie, for the visual field by confrontation, I want you to stand in front of me and about length arm away. Yeah, that's right. Okay. Reggie, I want you to do is you're gonna cover your right eye. Cover it. And I'm gonna cover up my left eye so that it's both side. Okay? Reggie, I want you to look at this eye, not on my fingers. Just stare into my eyes. Don't move your head, okay? And I want you to tell me how many fingers you can see, okay? Okay, here we go. Just stare at my eyes only, ha? Okay, let's start. Here we go.
1,
That's right.
3,
Okay, great.
4,
That's right.
2,
Okay, that's great. And in the other side of the eye, so cover up your left eye, and I'm gonna cover up my right eye so that it's both side. So again, just stare at my eye only, not into my fingers, and tell me again how many fingers you can see, okay? Here we go, let's start.
2, 3, 5, 2.
Okay, very good. For the third assessment, let's check for the cranial 3, 4, and 6, which is the oculomotor, cochlear, and abducens. For the cranial nerve 3, pupil reaction, cranial nerve 4 and 6 assess 6 ocular movements. First, check the pupils. The pupils should be round and equal in size. So, let's check the pupillary reaction by shining a pen light into the eye and then observe the direct and consensual reaction. So, now use a pen light finger and we're gonna move it slowly inward to the nose and observe for the pupil dilation. So here we go, stare off in the distance please. Okay, that's right. And Reggie, I don't want you to move your head or just anything. Just follow this pen light, okay? Okay, let's start. Okay, that's great. Thank you. So, lastly, check for the extraocular movement in the 6 cardinal direction of kids. So, Reggie, I want you to do is keep your head still and don't move your head, okay? Just use your eyes to watch where I move the pen light, okay? That's right. For the oculomotor, the pupils are equal, round, and reactive to light and accommodation. And for the cochlear, both eyes move in the direction indicated as they follow the examination pen light. And for the abducens, both eyes are moved in coordination. For the cranial nerve number 5, which is trigeminal, where the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. So, Reggie, look upward. Okay, that's great. To test the light sensation, have the client close their eyes and wipe a wisp of cotton over the client's forehead and paranasal sinuses. So, Reggie, I want you to close your eyes. I'm gonna wipe a wisp of cotton over your forehead and paranasal sinuses. Can you feel it? Okay. To test for deep sensation, use alternating blunt and sharp ends of the safety pin over the same area. So, close your eyes again, and I'm gonna use a sharp of the safety pin to your forehead again, and to the perineal sinuses. Okay, can you feel it, ma'am?
Yes.
Okay, that's great. So the patient feel the touch from the forehead and perineal sinuses. For the cranial nerve number 7 is the assessment of the facial nerves. So ask the client to smile, raise the eyebrows, frown, pop up cheeks, and close eyes tightly. So normally the patient can do these maneuvers easily. So Reggie, I want you to smile for me, okay? Okay, that's right. I want you also to raise your eyebrow. That's great. And frown. And pop out cheeks. And lastly, close tightly your eyes. Okay, that's great. Thank you. So, as you can see, the patient can smile, raise eyebrows, frown, puff out cheeks, and close the eyes tightly. And ask the client to identify various tastes placed on the tip of the side of the tongue, like sugar, salt, and identify areas of taste. So, Reggie, I want you to identify the various tastes that I will put on the tip of your tongue or the side of the tongue. So, Reggie, can you show me your tongue? And I'm gonna put this on the side of your tongue and identify the various tastes. So, please identify.
A salt and side of my tongue.
Okay, that's great. Another one. So, again, show me your tongue. And please identify.
A sugar in the top of my tongue.
Okay, that's great. The client can identify the salt and sugar and the areas of taste. And for the cranial nerve number 8, which is the vestibulocochlear, assess the client's ability to hear the spoken word and the vibration of the tuning fork. So we're gonna test one ear at the time and occlude one patient's ear with your fingers and then whisper a number or words. So I'm gonna occlude the patient's ear with my fingers and I'm gonna whisper a word. So Reggie, I want you to tell me what word have you heard from me.
Soccer.
Okay, that's right. Another one.
Football.
Okay, that's great. And next, we're gonna assess the lateralization using a tuning fork. So here we go. Let's start. Can you hear a vibration?
Yes.
Okay, that's right. Another side.
Yes.
Okay, that's right. As you can see, the patient can read the whispered word and a vibration from the tuning fork. Next, for the cranial nerve 9 and 10, which is the glossopharyngeal and the vagus. For the cranial nerve number 9, which is the glossopharyngeal, apply taste on the posterior tongue for identification. So, Reggie, I want you to say "ah" and to test for your gag reflex and open your mouth widely. And this might be hurt a little. And ask the client to move their tongue from side to side and up and down. So, Reggie, can you show me your tongue? And I want to move it from side to side, upward, and downward. That's right. Cranial nerve number 10, assess the client's speech for hoarseness. So now, ask the client to swallow, and this might be done without a difficulty. So, Reggie, can you swallow? Okay, repeat it for me. That's right. So, the glossopharyngeal gag reflex is present. For the vagus, the patient can swallow without any difficulty. For the cranial nerve number 11, which is the accessories, ask the client to shrug shoulders against resistance from your hands. So, Reggie, I want you to shrug your shoulder against resistance of my hand, okay? Okay, that's great. And turn your head to the right side. Another side, left side. And of course, upward and down. Okay, that's great. Thank you. The client can shrug a shoulder and can turn the head from the left right, upward, and downward against the resistance from the hand. And lastly, for the cranial nerve number 12, hypoglossal, ask the client to protrude tongue at midline, then move from side to side. I want you to protrude your tongue in the midline, and then move it side by side. Okay, thank you. And for the evaluation, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart.